Minimally invasive hip replacement surgery alleviates arthritic pain by replacing diseased bone with a prosthesis that is specially designed to function like your natural hip. During surgery, Dr. Berger makes a small incision on the anterior, or front side, of your hip to reveal the major muscles, tendons, ligaments, and anatomy of the hip joint. Once Dr. Berger identifies these crucial anatomical features, he uses surgical tools he designed to gently maneuver around the muscles, tendons, and ligaments to reveal the hip capsule that covers the arthritic hip bone that is to be removed. After making a small incision of the hip capsule, Dr. Berger maneuvers the muscles once again. He can now see the arthritic hip joint, which is a ball and socket joint comprised of two bones: the top of the thigh bone, the ball of the joint, and the pelvis, the socket of the joint. Dr. Berger then gains access to the arthritic ball without dislocating the hip, which causes damage to the muscles of the hip. He then maneuvers the muscles back farther and begins to prepare the top of the thigh bone for removal. Using a small precision surgical saw, he carefully cuts through the neck of the thigh bone, just below the ball portion of the joint, and removes the arthritic hip bone from the patient's body. Dr. Berger is ready to prepare the patient's body for the prosthesis and begins with the pelvis, or the socket portion of the joint. He uses tools that he specially designed to smooth the inside of the hip joint and fits it with a metal cup, followed by a smooth, plastic polyethylene liner that will act like new cartilage when the process is complete. With the pelvic prosthesis firmly affixed in the patient's pelvis, Dr. Berger now focuses on inserting the thigh bone component. Once again, he moves the soft tissue of the hip around to see the end of the thigh bone. He clears away any remaining arthritis from the thigh bone and inserts the stem component, approximately 5 inches in length, securely down into the thigh bone. Then the neck component is affixed to the end of the stem. And finally, a smooth sphere is affixed to the end of the neck component. The neck and the sphere are just tester pieces to make sure the prosthesis is the correct size in the patient's body. To ensure the correct size and alignment, Dr. Berger carefully inserts the head of the prosthesis, the new ball, into the plastic liner and tests the range of motion in the patient's hip. When he is confident he has the right fit, he removes the tester head and neck. And finalizes the replacement by attaching the permanent neck and head component. The prosthesis is now fully assembled within the patient's body. Dr. Berger completes the surgery by inserting the head of the component into the smooth lining in the hip socket. The incision is closed and the patient is able to walk on the new hip the same day of surgery. With the diseased bone removed, the patient is able to move free from arthritic pain and, following recovery, can return to their previous lifestyle.